Alex obviously wanted us to do something for lower back care, so I thought I'd do a little PowerPoint to kind of go over a few things. So it's kind of like a general overview. If you have any questions at any point, please just rock in and just ask anything you fancy. Cool, right, so just to summarise, anytime you have an issue with your body, it always relates to your skeletal, nervous or muscular systems. So they're like the three fundamental systems, certainly as it pertains to back, lower back pain. So if I skip this on. Okay, so your skeletal system is obviously, as most of you have kind of deduced, is your skeleton and the systems involved for it. So its primary function is obviously structural and to transmit forces through the floor for our extremities. In terms of back care, you have your spine and your connective tissues. These are the two that we're concerned with. So when I say connective tissues, I just simply mean tissues that hold other parts together. So like tendons, ligaments, cartilage to some extent. So here's a little picture of your spine. It's a pretty simple thing. In essence, you have three sections. So your upper section, or your cervical section, 7 different vertebrae. More towards the midpoint, you have your thoracic region, which has 12 different vertebrae. Lower down, you have your bottom section, which is your lumbar spine, or lumbar vertebrae, which contains 5 sections. Your next, your spine is composed of 24 different columns, or vertebrae. Again, divided into 3 sections, so see here now. Between each bone, you have a spongy, fibrous-like padding, a meniscus, or annulus, it's called, commonly referred to as spinal discs. Now, the function of these spinal discs is to lubricate joints, is to spread loading between bones, and to insulate the joints to some extent. So the idea is you want a nice kind of healthy gliding motion between these discs. So to move on, you've got a little picture there, which kind of like highlights, your vertebrae, your spinal disc. So if you can see here, you've got two vertebrae and a spinal disc in between. So kind of as we age, like anything in this world, we kind of wear away. We're not subject to that. We're kind of like soft machines, really. So as we age, obviously parts wear, bones rub against one another, and then things wear down. So, if you're somebody that's, say, sat awkwardly or has had poor movement during a space of time, this can kind of cause like a rubbing between bones, causing them to wear around and wear down. An issue with this is this can often become herniated. So say, for example, you're somebody who's kind of sat awkwardly or had awkward posture at a desk for a length of time, you might say become kyphotic, so you kind of get like an anterior roll. So that basically means your back becomes elongated, causing this kind of like herniation. So I'll move on to the next one. Next slide. No, so I'll give you a little diagram. So the way it would work is, say you lean forward between vertebrae, you can kind of get this kind of action going on. So if you imagine, like, here's a spinal column, and here's another one. And between, there should be a nice flush disc. Ideally, it would be like this, with your disc like this. But what can happen is if you have poor posture, you can get this kind of herniation going on. So the disc kind of bulges, and it should be nice and flush. And that causes synovial fluids to kind of press out inwards on the joint, respectively, depending on which area, which side you're tied on. So that gives you kind of like an idea of how it works. So I skip on. So nerve tissue is something else that you need to be concerned with. What happens is behind your spine, you kind of have your spinal cord. So here you've got a little example. You have your vertebrae, your spinal discs or annulus, and then what you have is your spinal cord. So what happens is if you have poorer posture, your spine can become out of alignment, pressing down on either side. Now the idea is there's a joint facet that sits just behind here, and it's like a nice smooth cavity that allows your spinal cord to run down unhinged, uninhibited. But what happens is if your posture becomes poor, your spine can flex and place pressure on your spinal cord. So what would happen in this instance, you have a nice flush spinal cord, no problems. But in this instance, you would have this issue here, and then you get impingement there. So that's what causes lower back pain. So ideally you want to kind of maintain a nice neutral position. You can get all kinds of orthopedic issues which can cause or contribute to lower back pain. So in this instance, you've got osteophytes and bursitis, or any condition that might impinge the nerve. So kind of pressing down on the nerve, similar to what we were talking about there. As you can see here, osteophytes, which is kind of like bony spurts and growths on your spine, which can in turn press down on your nerve, causing pain that you experience. Again, another example of disc herniation here, which is like your disc pressing out against the nerve, causing unwanted feedback. So obviously with your nervous tissues, it's the electrical system that runs your muscles. Anything that presses down on them causes you to experience pain. So it's not something that you want, it is desirable, you want to keep it nice and simple. Okay, what contributes to back pain or this impingement, pressing on the nerves, is short tight muscles and myofascia. And we're just going to talk a little bit about core muscles. So, when your muscles become tight and short, your body is literally like a cable system. So I'll give you an example. If you imagine your arms are short, what happens is your multifidus or your spinal erectors, which is on your back, become long. So one muscle becomes short and tight, other muscle becomes long and loose, or long and weak. So if you want to maintain a healthy lower back, or a healthy back in general, or a healthy body in general, then you would need to make sure that all muscles are at that optimal length and strength. So this gives you a kind of an idea of it really. Another thing to be concerned with is a thing called your myofascia. So if you imagine you looked under your muscle in a microscope, what you'd see is a fibrous collagen web, which is what holds all the tissues together. Now if the muscle becomes short or inactive or too weak, the fascia becomes very knotted. So when you hear this like expression, you've got knots in your muscles, it literally means your fascia has become too enriched, too entangled. And what that does is in turn it restricts blood flow and in turn macronutrient delivery, electrolyte delivery, so anything, just the vascular network in general. So blood can't get to the tissues very effectively. Another issue with this is when this web or this fascia becomes too knotted and too tight, it restricts and impinges your nerve tissues. So you might find a lot of people who are tight, they don't even know they're tight. They're kind of like, they might be sleeping in bed and might be struggling to get to bed, and sometimes you wonder why you can't switch off, but it's literally because your muscles are pressing down too tightly on your nerves, which makes it very hard to kind of switch off, because obviously your nerves are tied very much into your central nervous system and into your psychology. So it's good to have nice, supple, or optimal length muscles. So that's pretty much for that. So if I move on, you've kind of got this core thing here. Again, guys, if you have any questions, just please do jump in. I'll talk a little bit about the core muscles now. So the way it works with the core is everyone always kind of like hears about their core and they're not really too sure how it works. They just know it's this sort of midsection or midsection muscles they kind of think. So to give you an idea of how it works is if you imagine you take like a tin of beans or a can of beans or anything with 4 sides, or a front, sides and back, and you took away one core. So say for example you've got a tin of beans and you took the front section off, that tin would completely lose its structure, its rigidity would be compromised. And it's exactly the same with your core. The way your body works is it works like a cable system or a sling system. So one muscle pulls against another to keep a nice, rigid, tin-like structure. So if one becomes weak, the integrity of the system is compromised. So to give you an idea, for example, here you've got your pelvic floor, multifidus, spinal erectors, transverse abdominals, and that's pretty much what makes the core. Excuse me. So should something become weak, one thing pulls upon another. So I'll give you an example. If, say, you're somebody who's sat at a desk for a lot of years and have kind of hunched over a little bit, what tends to happen is the muscles that make up your chest will become short and tight, and they'll tend to pull upon your shoulders to pull them in forward. And because you've been kind of hunched in that position, the muscles in between your shoulder blades or your rhomboids will become loose, and that can cause a little bit of impingement on your C-spine or your upper spine. So the idea is your spine is being overly flexed forward, causing the nerves to become bunched and clustered around that area. So that's pretty much how the core kind of works. It's a kind of rigid system, and you want it to be as structured as possible to get transient forces at its best.